Week number 8, lecture number 1.
Hello everyone.
Hello, friends. In this week, our topic is symptoms management.
Symptom management in palliative care is very important. In spite of all the treatment, palliative care patients do have very distressing symptoms. If they are not relieved, again their daily routine is affected, their diet is affected, and their overall well-being is affected. So symptoms which may be a small symptoms like nausea and hiccups or very distressing symptoms like dyspnea and delirium. Here in this week we are going to teach you about various symptom management starting with first lecture of gastrointestinal symptoms. The symptoms arising from gastrointestinal tract which will include nausea, vomiting, constipation, diarrhea, hiccups, etc. Each symptom needs to be studied in detail with and each symptom has, when you are managing it, there are two types of management. Can you say that?
Two types, I want
It is
simple and
pharmacological management,
pharmacological and non-pharmacological.
non-pharmacological.
Yeah.
So, in pharmacological, we'll be using various drugs, and in non-pharmacological, other methods which can relieve the symptom to certain extent, and of course, psychosocial support is always part of any management in palliative. The second lecture is on respiratory system. Again, this is related to trachea, lung, and thoracic cage. And patient may have very distressing symptoms like dyspnea, breathlessness, where he is not able to breathe, choking sensation may be there. Other symptoms we'll be discussing under this heading are cough, hemoptysis, and persistent cough. Again, same, some non-pharmacological methods has better results in this, like suppose in dyspnea management, non-pharmacological methods are very useful as a supporting system to the pharmacological method. One new thing you will learn in this is that tablet morphine is prescribed for dyspnea management. And as a doctor also, you might not have heard about this treatment, and when you will go through this lecture, you will definitely find it interesting and your knowledge about the management will improve. The third lecture is on symptoms related to central nervous system. These are dementia and delirium. Dementia usually related to old age, but it becomes pathological when it affects the routine of the patient or his daily life of the patient. Delirium very commonly found in palliative care patient, particularly cancer patient, particularly head and neck cancer patients, where their intake is very much affected. And it can be sometimes resolved with simple treatment of giving IV fluids or improving the electrolyte imbalance and giving few drugs. In terminal phase of the disease, this delirium may be irreversible, and a physician should be able to identify this terminal delirium, and here the treatment changes a bit, where you may have to opt for terminal sedation of the patient. So again, very good presentation, and you will learn a lot out of it.
you said that dementia generally happens to old people like me
Not
who have crossed
exactly.
70 years, and
No,
I
they
think that is why I generally forget so many things nowadays. Maybe,
no. There is a difference between dementia and normal aging. Normal aging, you forget the things often. Only the things you will forget are the people and name you will forget are the one whom you are not meeting every day. You are meeting them rarely, occasionally. Then it is normal. But in dementia, you will forget the name of the people in your family, in your home, your near ones, and all such thing. And that happens very frequently. Then it is dementia. So I think it is your forgetfulness is age related and not dementia.
okay, I got it. That means in computer language, certain files are being deleted, and
Related.
therefore I just don't remember.
Yeah.
Thank you.
Yeah. Another lecture in this week, you will be handling emergencies in palliative medicine. There are certain emergency situations which can threaten the life of the patient, and many of them are reversible. So, a prompt diagnosis, immediate treatment, and proper approach, a maybe multi specialist approach is required to manage such emergencies. The emergencies which we will be describing under this lecture are superior vena cava compression, spinal cord compression, hypercalcemia, and bleeding, massive bleeding. So these are the emergencies. You will be come to know that how to handle them and how to diagnose them. Coming to last lecture in this week, it is a recent advances in management of nausea and vomiting. Some portion of this lecture is revision for you, as this is already talked in the first lecture of GI tract symptoms, where we are treating nausea vomiting. But here few new points are added, particularly for chemotherapy induced nausea vomiting. 80% of the patient who are on palliative care, they might be receiving chemotherapy simultaneously, and they are having nausea vomiting because of chemotherapy, and for symptom management they are referred to palliative care physician. So you should know the recent new drugs which has come into the market since last decade or so, which are very useful in treatment of nausea vomiting, and because of that the compliance to chemotherapy has improved as far as patients are concerned. So this is very important topic, briefly describe about the recent advances in management of nausea and vomiting. So that is the end of week 8.
Okay, so coming to the theme part of it,
Yeah.
what I understand, Dr. Gita Joshi, that just like pain management, symptom management also reduces the pain. It it sort of brings peace of mind to the people, and thus it increases the quality of life.
Yeah.
So can we coin something which is related with quality of life and symptom management, like treat the symptoms, treat the symptoms and improve the quality of life.
Yes.
Treat
Treat the symptoms and
and
improve
improve the
quality
quality
of
of
life.
life. Thank you.
Thank you.
Thank you, friends.